Morning, everybody. 1 in 5 Americans will be diagnosed with skin cancer in their lifetime. Melanoma, the worst kind, is the second most common form of cancer among women ages 15 to 29. The American Academy of Dermatology reports that women in that age group are more likely to be affected than men. The ADA also saying that the best protection for yourself is to apply sunscreen every day. Yes, not just when you're going on vacation or the beach, every day. Joining us in the studio with more, we want to welcome Dr. David Wink, who's with the Florida Cancer Specialists and Research Institute. Thank you so much for coming in.
Thanks for having me.
You know, that melanoma is a really scary word, but you all have kind of distilled it down to A, B, C, D, E. Explain what that is.
Absolutely. So melanoma is kind of the scary type of skin cancer. You've got the non-melanoma, which is the squamous and the basal cell cancers, and then the melanomas, which we know are the more aggressive type that need to be treated more aggressively. So out of melanoma, when you're looking to find early stage melanoma, which is highly curable, there's something called A, B, C, D, E. And when you look at a lesion or a spot that you're concerned about melanoma, the first part is A. Is there asymmetry? When you look at it, does it look different from one side to the other? It's not symmetrical. The next thing is the border. Is the border not clean? Maybe you see some jagged edges. Exactly. C for color. Melanomas will change their color. They're not uniform. A normal mole might be purely brown, but when you start seeing black or blue, some discoloration, that's a sign that this is maybe something that's suspicious. D for diameter. Most benign moles are small, 1/4 of an inch or less. When you start seeing things that are larger, again, it makes you concerned that this is potentially a problem.
And what's E?
And E for evolving. Is it changing? And that's the biggest thing I tell my patients. When you look at your body, is something changing? Is a mole that you've seen for years, does it start to look different? And that's a sign that potentially something's happening.
Our viewers ask us all the time, do the higher numbers of SPF really work?
They do to a point. So SPF is sun protection factor. So I like to explain to patients that if your skin was normally going to burn in 10 minutes and you have an SPF of 30, you multiply 10 by 30. So that's 300 minutes or roughly 5 hours. Now you should not go 5 hours without reapplying sunscreen. We say every 2 hours at least. You should also apply it at least 30 minutes before you were to say go out in the sun. You need time for that. Before is the key. I'll see people all the time, they'll put sunscreen on, they'll go jump in the pool.
Absolutely.
You need to give it some time to absorb to the skin, otherwise it's just going to be washed off.
A lot of great advice. Thank you so much. We'll continue the conversation on Facebook. Thank you so much for coming in. If you would like to learn more about the Florida Cancer Specialists and Research Institute, you can visit them online, see all of their locations throughout the Tampa Bay area and West Central Florida. It's flcancer.com.